Thanks so much, Dr. Filizzola. It's a great honor to welcome our second year PhD and MD PhD students in biomedical science and neuroscience at Mount Sinai to this special lab coat ceremony. And I can say how wonderful it is personally to see you all here IRL, my favorite acronym, in real life. I also want to welcome your family and friends who unfortunately have to be with us online. Like Marta, I really look forward to a time very soon when we can all get together in person. Your class is the most affected by the COVID-19 pandemic, which is why we're holding this event now in your second year, because we couldn't meet in person a year ago. Many of you had your college graduations in spring 2020 ruined by the pandemic. I expect that many of you also had long-sought travel plans also canceled. And all of you arrived at Mount Sinai in late summer 2020, many moving to New York City for the first time, finding yourselves in Aaron Hall with severe limitations on visitors and on getting together with classmates and others, no gymnasium, and so on. Even though by summer 2020, conditions on the ground had improved enormously here at Mount Sinai, our labs had opened with full-time effort by the end of June. Your cohort had all virtual classes, lived with partial lockdowns, which made it difficult to meet with fellow students and postdocs socially. Our more senior graduate students were in a far better situation because they were already working in their labs, which provided a built-in social network and source of support. I wish that we could have been less restrictive, but were explicitly limited by federal, state, and local mandates on healthcare organizations. Let's hope that our nation and world will not see another pandemic for the rest of our lives. This one is more than enough. So here you are a year later. I trust all of you have found laboratories for your dissertation research. The start of year 2 is probably way too early for most of you to feel that your research is in a groove. That's normal. It's not often until the start of year 3, sometimes year 4, that a PhD student has an experimental system that works and generates lots of data so that real light can be seen at the end of the tunnel. I trust as well that the dark social isolation from a year ago has brightened considerably and that life is getting back to normal, or at least a new normal, still wearing masks. Your families are here on Zoom, but clawing back to normal nevertheless. So let's talk about that new normal and where we find ourselves. I am now officially post-pandemic Eric. I'm endemic Eric. COVID-19 is here and it will not be going away. We need to learn how to live with the virus. The availability of astoundingly effective and safe vaccines developed in record time based on advances in fundamental molecular biology and virology research over the past 2 decades, makes COVID-19 relatively harmless to the vast majority of us. Our experience with influenza, I think, is educational. The influenza virus is still with us 100 years after the 1918 pandemic. Despite annual vaccinations that actually began in the 1930s, and the vaccines remain far less effective than the COVID vaccines, influenza before COVID was killing on the order of 30,000, sometimes as many as 50,000 people each and every year in the United States. We need to learn how to live and thrive despite the presence of COVID. We need to get back to getting work done, back to a rewarding, enjoyable, and socializing life in the face of a virus that will be with us for some time. How do we do this? First, we need to get used to getting sick again. I think anytime a person gets a symptom of a cold or flu, they panic, but that's part of the human condition. You know that more colonial soldiers died during the American Revolution from smallpox and other viral and bacterial illnesses than from combat. And because of dramatically improved sanitation, increasingly effective antibiotics, and an astounding and ever-increasing range of effective vaccines, we are very fortunate to live in a society where the impact of infectious disease is extremely small compared to even 100 years ago. Second, we need to weigh relative risk and make decisions accordingly. In my humble opinion, IMHO, another great acronym, and what do I know? I'm a psychiatrist, neuroscientist, husband, father, and I might add, grandfather of a brand new 2-month-old baby girl. Thank you. We cannot make decisions based solely on infectious disease considerations. You know, an analogy would be to make military decisions based solely on military considerations without weighing many other risks, opportunities, and consequences. Likewise, we need to balance infection risk reduction with many other dimensions to our work and personal lives. Our goal cannot be zero infections. As I said, humans get sick. We cannot have zero risk. Life comes with unavoidable risk. After all, if we wanted zero risk in life, we should have 5-mile-per-hour speed limits on highways. Our nation tolerates 50,000 motor vehicle deaths each year because of the advantages that come with faster travel. I am very proud that we've been able to achieve at Mount Sinai a good balance within the constraints placed upon us by government agencies. We opened our labs faster and to a greater extent than any other medical center in the United States, which minimized the disruption to our students and postdocs' careers. And we did so safely. We have had 0 cases of COVID-19 contracted in our labs over the past 18 months. I'm going to repeat that. We have had 0 cases of COVID-19 contracted in our labs over the past 18 months. A small fraction of our faculty, trainees, and staff have tested positive, like our relatives and friends, but contract tracing revealed that 100% of those cases were contracted off campus, typically in social activities on evenings or weekends as life went on. We got this big decision right. Now, our faculty, trainees, and staff with young children need to exercise additional precautions. This should be eased as vaccines are introduced for younger and younger children, and we're hoping that children at 5 and older will be approved soon. We know that some of our colleagues are immunocompromised and cannot be vaccinated for medical reasons, and we need to ensure that those people are protected and offer special dispensation so that they can get their work done safely too. And there are still real struggles about traveling to see family, especially overseas, not to mention the mental health toll of 18 months of social and, for many, economic deprivation. But despite these challenges, let's all fight back. Let's get back to the labs in person, back to in-person lab meetings, in-person WIPs, in-person research seminars, and in-person conferences. Zoom is better than nothing, but it doesn't come close to doing things IRL, especially when we have our cameras off. And we received good news today about international travel, another sign of things slowly getting back to normal. I have always considered myself one of the luckiest guys alive because every day I love going to work where I get to run a lab, work with young people like yourselves, and pursue science, my life's passion. I hope that each and every one of you use your PhDs for an equally rewarding and enjoyable career. Thank you.